Moving forward, we have another speaker, Dr. Dhrushi Patel, who would be speaking on behalf of Dr. 𝙁𝙗𝙗𝙗𝙗. He is not able to join us due to unavoidable circumstances. Dr. Dhrushi Patel is consultant radiologist at Gujarat Imaging and Samved Hospital. She also has a keen interest in musculoskeletal radiology. I would like to invite her on the dais.
Thank you for the kind invitation and thank you for having me. I would like to thank Dr. Mohal sir and Rosal for having me here. This is an impromptu lecture and I'm filling in for Gaurav, who couldn't be here right now. I'm going to talk on imaging of plantar fascia. So plantar fasciitis is a low-grade inflammatory process involving the plantar fascia, wherein it can be de novo or it can be due to an underlying systemic disease. And in adults, it may be associated with pes planus or cavus. Other features which are responsible for it are stress due to repetitive trauma or degenerative disease or associated systemic diseases. So the systemic diseases associated with plantar fasciitis are seronegative spondyloarthropathy, like ankylosing spondylitis, reactive and psoriatic arthritis. Typically, the patient presents with heel pain first thing in the morning as they put their foot down, or after prolonged sitting, and when they try to weight bear, there is severe heel pain. The imaging modalities for its evaluation are ultrasound and MR. Plain radiographs are obviously non-specific. There are no findings on plain MR, but the foot abnormalities like pes planus can be identified on the radiograph, and sometimes there might be a speck of calcification at its attachment at the calcaneum, which can be appreciated on a radiograph, or there may be an inferior calcaneal spur that can be identified. On ultrasound, the plantar fascia is seen as a linear band, which is hyperechoic, and you have to trace it from the calcaneal attachment. And it is, if it is more than 4.5 millimeters, it's considered to be thickened. But more importantly, comparing it with the contralateral side, if it is asymptomatic, is better. On MR, we can identify the edematous changes in the plantar fascia, as well as some marrow edema that may be associated with in the calcaneum at the site of its attachment, or there may be inferior calcaneal spur that can be identified on MR. So these are the ultrasound images. The first one is the short axis image of the plantar fascia. This is an asymptomatic side and this is the symptomatic side, where you can see that the fascia is thickened compared to the normal side. This is the long axis view, where you compare it with the normal side, it is thickened and hypoechoic. The same thing, this is at the calcaneal attachment. At the insertion, this is the asymptomatic side and this is the symptomatic side. Here you can appreciate that there are hyperechoic and linear appearance, whereas it is hypoechoic or dark areas suggesting edematous changes at this side, and also there is thickening of the fascia at its insertion. When you put a Doppler, you will see that there is vascularity around it. On an MR, the typical appearance is thickening of the plantar fascia, and there is this bright area is the edematous changes, and this is the edematous changes at its attachment in the calcaneum. The T2 weighted images are good to identify these, whereas on the T1 weighted images, you can appreciate the spur better, inferior calcaneal spur at the site of attachment of plantar fascia. This is an example of one of the complications that can occur, wherein here it is engulfed by an abscess and there are other inflammatory changes in the 𝐾𝙲𝙗𝙗 fat pad. This is not per se plantar fasciitis, this is rather a complication and abscess. So the take-home message is that you need to understand the anatomy and the imaging modalities for evaluation of plantar fasciitis. There is a difference between normal and abnormal, and when you compare it with the contralateral side, especially on ultrasound, helps. And you can follow up after an intervention or physical therapy or intervention related to how the response is on ultrasound. Thank you.